Yeah, just a quick review of the Comfytemp 3D red light therapy knee wrap. Say that 10 times. Anyway, why would someone want to use something like this? I mean, what's the purpose of it? Well, this is made really for people that have some kind of knee problem or they're struggling with some kind of knee pain. And then just how does this thing work to get rid of the knee pain? Well, there's two main things that this knee wrap does. One is vibration. So we all know that vibration kind of relaxes the muscles, increases the circulation, and all that helps your knee feel better and helps it heal. The other thing is it has this red light therapy. So what does red light therapy do? Well, when you have red light therapy, basically it increases blood flow and helps stimulate cellular activity. And both those things here again help heal your knee. So if you have some kind of knee problem, get the circulation back, relax the muscles, stimulate those, that cellular activity, you get healing going. That's really what this one is all about. Other things you can do, for example, just get this from Bulletproof Your Knee book. It's one resource. If you have any kind of knee problem, also make sure you do at least one exercise for your quadriceps muscle. Quadriceps muscle is the main stabilizer of your knee joint. So it's made up of 4 different individual muscles, but collectively it's called the quads or the quadriceps. So researchers are now finding that probably just about any knee problem you can name. I can probably show you a study where researchers have tested the muscles around the knee, and they find selectively you have weakness in your quadriceps muscle. So for some reason, knee problems take its toll on your quads. So for instance, knee swelling in the quadriceps. Look at this. Another study demonstrated that even if you have as little as 20 milliliters of fluid in your knee, which is just over a tablespoon, is enough to decrease the strength of your quadriceps muscle. So if you have any kind of acute, like sudden onset swelling or chronic swelling, it takes its toll on your quads. Knee injuries in the quadriceps, have any kind of say you fractured your leg bone, your tibia, or if you've had prior surgery, where they open up the knee joint, researchers find unusually weak quadricep muscles. Ligament problems. Here's the anterior cruciate ligament, also known as the ACL. You've heard of football players tearing their ACL. So, look at this. One study looked at people who ruptured their ACL, and researchers found the strength of their quad muscle in the injured leg was decreased by 25 to 30%. So here again, you take a muscle that's supposed to stabilize your knee, and you've taken its strength down 25 to 30% over a quarter of its existing strength. It's going to be hard to come back from that one unless you get that strength back. Same thing with the posterior cruciate ligament, medial collateral ligament. Knee pain in the quadriceps. They find that people have pain in their knee, that the quadriceps just can't contract like it should, and they find weakness. Knee arthritis in the quadriceps. That's an interesting one. So if you Google knee arthritis and quadricep strength, you're going to find super consistent in the research that when they look at people with knee arthritis, they find they have weak quads. Hamstrings are fine, but quads are weak. Likewise, there's randomized controlled trials showing that if you take a group of people with knee arthritis and you strengthen just their quadriceps muscle, that their knee pain starts to go away. And some of these studies are even finding that if you that the people with the stronger quads have the least progression of their knee arthritis over time. So you've got a lot of reasons to strengthen your quads if you have knee arthritis. Patellofemoral pain. So the list just goes on and on. Make sure you do at least one good exercise for your quadriceps muscle. That's the moral of the story. Fine-tune control over your knee. Well, sometimes you can have a terrible knee pain, and the problem, it has nothing to do at all with your knee. It's basically the problem's up at the hip that's causing problems down at the knee. Classic example is iliotibial band syndrome. So if you take a group of people with iliotibial band syndrome and you muscle test their hip muscles, you find they have unusually weak hip abductors. Okay, and the hip abductors keeps your pelvis level every time you take a step, and also brings your leg out to the side. So here again, just like with knee arthritis, you take a bunch of people with iliotibial band syndrome and you strengthen just their hip abductors, iliotibial band syndrome starts to go away. So here again, that's targeted exercise. Optimize knee flexibility. Well, we all know your knee has to be able to bend and straighten sufficiently. A lot of people don't know your knee actually rotates. So about the last 10 to 15 degrees of extension, where you straighten your leg out, your knee actually rotates laterally out, or out to the side. And here's a little test to see if you have that accessory motion. You can stretch that out to get that back. Last thing you can consider doing, increasing dynamic knee stability. So here we're talking about proprioception. Proprioception is your position sense. So let's say I suddenly turn the lights out and you're sitting in the dark. You'd probably be able to tell me whether your knee is bent or straight, okay? And that's because you have these receptors in the joint and the surrounding muscles, and it's constantly giving your brain feedback as to where your knee is in space. Research here again, researchers are going around checking out people with various knee problems, and they're finding proprioception has really decreased. So it's not like these people don't know where their knees at or anything, because that'd be a big neurological issue. But it's just decreased. It's not really what it should. So that's something you want to get back, just to have a fully functioning knee. But yeah, getting the pain down using something like this so that you can do exercises, get long-term relief, I'm all for it. So good product. Check it out.